that passion really has to be there. If you're looking at this particular program, I would recommend you think about what you really want in a graduate program. I'd also encourage you to think about where you want to be professionally in 5 or 10 years. So I really love taking care of sick kids and the variety of things I get to do as an acute care pediatric nurse practitioner. So in a single day, I might take care of a 5-year-old boy with asthma, and he might tell me all about his favorite superhero. Then I might go into a different room and take care of a teenage girl with diabetes and help her manage her disease better, which might help her spend more time being a teenager and less time in a hospital. And then I might work with a family whose child is near the end of that child's life and work on making really special memories for that child. So no matter what it is that I'm doing, I feel really privileged to have the opportunity to care for these children, and I really love what I do. So students first start out with foundational courses, so courses like pathophysiology, pharmacology, advanced health assessment. And then as students progress through the curriculum, they enter their specialty courses. So those are the courses where we focus specifically on acute care pediatrics. And we use a variety of teaching formats during those courses, everything from lectures, traditional lectures, at-home self-study, group work, case studies, simulation, and then finally over 600 hours of clinical practice. Some semesters, there are a number of courses that students can do from a distance. As students progress through the program, they spend more time on campus doing things like participating in simulations and doing things with their smaller acute care peds cohort. As students get towards the end of the program, so there's the opportunity to do clinical placements both locally, and then we also have students who do clinical placements nationally. So that's fun for students who either have a particular interest or want to go back home. So our graduates are in so many different places locally and then all over the country, anywhere that there are children with acute, critical, and chronic illness. So for some people, that's working in an outpatient subspecialty clinic. Others work in a pediatric emergency department. Others work in an inpatient unit or in a critical care environment, but all focused on taking care of kids with acute, critical, and chronic illness. The specialties that our graduates are working in are really quite varied. So anything from a pediatric ICU to pediatric hematology, oncology, pediatric cardiac surgery, pediatric cardiology, pediatric neurosurgery, the list really goes on and on. If you are interested in taking care of sick kids, there are so many opportunities and they're really endless. I think at Michigan you have the benefit of all the resources that come with a large institution like the University of Michigan, plus a small cohort and really some individualized attention. So our cohorts are small. You get to know the people that you're in class with very well. You get to know your faculty very well. All of our faculty are practicing clinically. So we bring our experiences taking care of children. I think it's really important. I think it's one of the greatest strengths of our program, honestly. I think us doing clinical placements allows me as the program lead to have really good relationships with all of our preceptors. So that allows me to make the best match between the student, their personality, their learning styles, their interests, and that clinical site and their clinical preceptor. When students are out there doing their own clinical placements, often they're just so desperate for any clinical experience they can find, and that's really different than the way that we do clinical placements here. I think the small size of our programs really allows the faculty to really get to know the students, what their interests are, what their previous experiences are, and where they want to go in the future. So this coming semester, we have 2 students who are very interested in pediatric hematology and oncology. These are nurses who have worked in those areas in their own professional practice. These two women are now going down to St. Jude Children's Hospital in Memphis, Tennessee for their clinical placement. I think really getting to know the students, getting to know what interests them, what their learning needs are, really allows us to identify opportunities that are really unique and really set the trajectory for their future career.